Radio Cayman since 1976.
This is For the Health of It with Tara Bush. Brought to you by the Health Services Authority. Caring people, quality service. Visit hsa.ky.
For the Health of It with Tara Bush.
Brought to you by Healthcare Pharmacy, where they care about your health. 2 locations, Governor Square and Grand Harbor. Refill and transfer prescriptions online. Call 947-8900 or visit healthcarepharmacy.ky. Also brought to you by Cayman Medical Center, Cayman's most awarded private medical clinic.
And UHealth, International University of Miami.
World-class healthcare in the heart of Miami.
The Light Room, your holistic sanctuary for physical and mental restoration, repair, and rejuvenation. The power that made the body heals the body. 38 Pasadora Place, Georgetown. Find us online at www.thelightroom.ky or call 938-HEAL.
For the Health of It with Tara Bush.
There's nothing more important than your health, and seeking expert healthcare with physicians you can trust is what you deserve. UHealth, the University of Miami Health System, offers peace of mind to you and your family with a first-class experience. Our patient coordinators assist with everything you need before, during, and after your stay with us. As South Florida's only academic-based health system, UHealth offers cutting-edge treatment, compassionate care, and life-changing results just a flight away. Learn more at umiamihealth.org/international.
When I first started going to Healthcare Pharmacy, it was because it was convenient. But over the years, I continued to shop there because I trusted them. One day I was picking up my prescription, and the pharmacist noticed an over-the-counter medication in my basket. She said, "I hope that's not yours. It will interact with your prescription." And I thought, wow, thank you. Trust is so important when it comes to your health. Healthcare Pharmacy with 2 locations, Grand Harbor and Governor Square, where they care about my health.
In today's world, stress is a constant, and our bodies feel it. We live in a near permanent state of fight or flight, where survival takes priority and healing has to take a back seat. But true recovery happens when we slow down. That's when digestion improves, inflammation lowers, and the body begins to repair on a cellular level. Because healing isn't just about doing more, it's about allowing stillness and deep rest. The Light Room facilitates this. Make time to rest, time to heal. Your body knows what to do. Find us at thelightroom.ky or in Pasadora Place. We now offer full-body red light therapy as well.
Hello and welcome to For the Health of It. We are interviewing Candice Landford. She is a pelvic health physiotherapist. Hello and welcome to For the Health of It, Candice.
Hello. Thank you so much for having me. I'm very excited to be here.
Well, we're excited to have you here too. So now men and women have pelvic floors. Let's clear that up. I had to Google it for a minute to make sure that poor men had this. I know that makes me sound not so bright, but that's okay.
No, I'm sure there's lots of people wondering.
So what does a pelvic floor or pelvic health therapist do?
Okay, so you're most likely familiar with a physiotherapist in general. So physios are neuromusculoskeletal specialists. We work in the field of muscle dysfunction, joint injuries, nerve dysfunction, the exact same way that you can have dysfunction in your back, in your hip, in your shoulder, in your neck, so too you can have the same thing happening in your pelvis. So a pelvic floor physio works with concerns relating to the pelvis. So we would assess and treat and rehabilitate and do exercise for concerns relating to this region. So I'm assuming that potentially clears it up a little bit. Mm-hmm. So we would work with concerns such as incontinence or constipation or pain, pelvic pain, menstrual pain, chronic long-term hip or back or coccyx pain, those types of things. And it varies through different life phases. So it might be during pregnancy, you get pelvic pain. It might be postpartum, you've got diastasis recti, or it might just be an elite athlete is now experiencing incontinence when they jump on the trampoline. So it really can vary. And like I said, with physiotherapy, we're doing physio for the pelvis. So we might assess externally, we might assess internally, and do treatment and rehabilitation in relation to whatever your goals are.
So you go a little bit beyond Kegels.
100%. So I don't like to call them Kegels or Kegels. The reason being is that, okay, if you go to the gym, you don't just pick up a weight and just do on and off bicep curls, right? You do so much more than that. You would stretch, you would lengthen, you would do mobility routines, you would do your strength, you would do powerful strength, you would do an endurance strength. So why is the pelvic floor different? Why is it with the pelvic floor, we're just doing on, off, on, off, on, off, on, off, on, off, these boring so-called Kegels? Your pelvic floor also needs to be able to relax, to release, to strengthen, to activate with power and endurance, depending on the activity you're doing. So Kegels can oftentimes be more damaging than good.
Okay. Well, thank you for that.
Yeah.
I mean, we've often heard, or, like when we something about our grandparents, they sneeze, or the woman who's just had a baby, she sneezes or something, and they have a little extra pee come out. Yeah. So that's one of the things with a physiotherapist like yourself does. And then you said something about the poo.
Yes.
Okay. And then it's pleasure, which is
yes.
Can be related to intercourse. And what else am I missing, Candice?
So I typically go through a little bit of a alliteration to help people to remember the areas in which I treat. Mm-hmm. So I'm going to go through that with you now. You've pretty much covered most of them, but a pelvic floor physio will work in and around the topics relating to pee, poo, pleasure, pain, periods, pregnancy, postpartum, postmenopause, prolapse, and pelvic floor. So that should kind of cover the bases at least.
And while this might be a little bit embarrassing for some people, these are all real stuff that we all go through.
Totally. So these areas might be taboo, they might be a little bit awkward, which they shouldn't be, because it's part of your body, it's part of your health. They all contribute to comprehensive health and well-being, right? Mm-hmm. Your period can end up impacting your day-to-day, your ability to go to school, your ability to go to work. You might find that, chronic coccyx pain is now stopping you from being able to sit and play with your children or sit in class. These areas shouldn't be neglected compared to treating a back pain, a shoulder pain, a neck pain, etc. So it's not always pain. Sometimes it's weakness, stiffness, etc. But yeah, they're taboo and they shouldn't be and they don't need to be.
Mm. Yeah. So your coccyx, that's your, for lack of a better, your tailbone. Yeah. And so you're sitting down and there's a lot of pain. How do you treat that?
So we would assess it just like you would assess a knee. We would either assess it externally by looking at your tissue, looking at how your pelvis moves. We can look at how your coccyx moves when you move by touching external, or we can palpate internally. So we would go almost similar to what you would have done when you go to a gynae. We'd have an internal examination, but we are then looking at the muscles that attach to that pelvic floor, to that coccyx, and we would assess, is there a strength issue? Is there pain? Is there injury? Is there spasm? And is that contributing to coccyx pain? So we can look at it externally, internally, as well as treat it externally or internally.
And how is something like that treated if you assess it to be too tight?
Okay, so if the joint is too tight, we can mobilize the joint. So we take it through a progression of movements and grades depending on your symptoms. So we might move that coccyx depending if we're working internally or externally. And we might release the muscles that are attaching to that coccyx, or we might strengthen the muscles that are attaching to that coccyx, because sometimes the coccyx can be shifted out, shifted in, or shifted to the right or the left. So we would need to assess, where is it sitting? What's causing your pain? What can we do to manage that pain? And how can I give you exercises to go home and continue to manage that pain?
We've all heard about, people who have incontinence.
Yes.
But it really did intrigue me a bit. How does this all work with people who have constipation? I was like, nah, how does this work?
Okay, all right. So constipation is incredibly prevalent, and I'm pretty sure it's under-recorded. So a lot of the times we don't know that we're constipated. So the way in which the pelvic floor relates to constipation is when you're standing and when you're sitting, your pelvic floor wraps around your rectum and gives it a kink. So think of a hose pipe that's being kinked. That stops anything from leaking out, right? It helps to almost control. What can happen is that muscle can get too tight, too stiff, too weak, whatever it is, and now you would struggle with either passing stool. So when you want to go to the loo, that muscle should relax so you can allow stool through. And if it doesn't have the capacity to, because it is in spasm, then you would need to go to a pelvic floor physio and learn how to relax it, or have it manually treated to relax that muscle. The same thing would apply if you were leaking. Maybe there is an element of weakness there, and we would need to then strengthen to improve that ability to kink that rectum.
Okay.
Does that make sense?
Yeah, it does to me. So how does it relate to when you have painful intercourse?
Okay. So these muscles, if you imagine them like a bowl at the base of your pelvis, they contract and close off your sphincters. So close off the rectum, the anus, the introitus, which is the entrance, as well as the urethra, which is where wee comes out. So they contract to close and they relax to open and let go. So that would allow wee out or allow a stool out, but it also allows an opening at the entrance. So if there's spasm, injury, pain, tension, then we might struggle to allow for penetration. It might be difficult, impossible penetration. It might be superficial, which is just on the outside, or it might be deep discomfort and pain. So we would need to see, can we relax and release these muscles? Can I teach you how to do that on your own to reduce pain? Because penetration should never be painful. Whether that's penetration when you go to the gynae, or if it's when you are having your period and you're trying to using menstrual products, none of this should be painful. And that's a message that we really need to get out to our teens who are having their first cycles, as well as throughout the ages. It's incredibly common, way too common. This is called dyspareunia, and it's found up to a year postpartum. 20% of individuals will still have pain, which is just not okay, because there's lots that we can do.
Okay. What can you do for, you said people who are menopausal, How do you treat them?
Okay, so what often happens and what I find in practice is that we go through our lives and a little niggle here, there. Oh, every time I jump on a trampoline, there's a bit of leaking. Or when I giggle too much, there's a little bit of leaking. All right, and we can tolerate that. We kind of just go through the phases with it. I'm just going to put a little caveat here to say that should be treated. But a lot of the times these things are neglected. They're left for years and years and years. Then when we get to postmenopausal, when there starts to be activity changes, because now you might be a granny or you might be a grandmom, and also there's hormonal changes. And at this change in phase, this transition into menopause and postmenopause, these symptoms that were once a niggle can become that much more prevalent. So we find that in this postmenopausal phase, we're having to now manage concerns that have actually been there for years. So that's one of the most common things that I'm treating. And then with those hormonal changes, sometimes we get a dryness, so your tissue integrity changes. So you might look at an elderly individual and you would look at their skin, and even on their arm or their face, their skin looks drier, a little bit thinner, and the same thing happens to your vulva. So sometimes we need to try and manage any pain or loss of tissue integrity that the individual might have from that menopausal phase.
Okay. And you also do, forgive me, I'm not going to say it properly. In fact, I'm not even going to say it at all. I'm just going to tell you what it is, and you're going to name it. It's where the stomach muscles separate.
Abdominal separation. So that's diastasis recti.
Right.
And it's given a few different names. So it can be rectus abdominis diastasis or diastasis rectus abdominis. So a lot of people find it a bit of a tongue twister. Don't worry.
I wouldn't even try. So, explain how you working with someone like yourself can help to heal that situation.
Sure. Okay. So diastasis is 100% common in every single person that goes through a full-term pregnancy. It's not something that you need to try and avoid during pregnancy. It's a natural process where your belly is making space for a growing baby. At about 6 weeks postpartum, this is where we should see a majority recovery. If there are aspects such as multiple pregnancies or consecutive pregnancies, sometimes we find that this doesn't quite regain tone. And that would then present as like a doming down the middle of your belly. So you might find you getting out the bath or you're doing a sit-up and you get this coning or doming down the middle of your belly. So that's the diastasis recti. So in physio practice, we would assess it. We would assess it with using an ultrasound. So I've got an ultrasound at a line where we would scan through your belly and we can see what's happening with those muscles. How far apart are they? How bulky are they? How strong are they? What happens when you do a sit-up? We can also assess it and test it and measure by using my hands. And I would then see what's happening in your functional unit. Do I need to help you to release your muscles? Do I need to help you to strengthen your muscle? Every single person is different. And then I give that individual exercises that are appropriate for where they are. So some people need really foundational exercises, just starting from the basics. Other people we can push. And it depends on you, your history, your hormonal history, if you're breastfeeding, if you're not breastfeeding. So there's so much that can be done. It's not necessarily something that needs surgical intervention. especially at the lesser degrees of diastasis. So when there's quite a narrow gap. And even if the individual is having a surgical procedure, they would benefit from first having appropriate exercises done to improve tissue integrity, tone, as well as their recovery post-surgical. So there's a lot that can be done. And I found, maybe less than 5% of the patients that I've seen with diastasis have needed to go for surgical intervention.
Okay.
Yeah.
So when do you know if you have a weak or a tight pelvic floor?
Conundrum, that one. So pelvic floor really can vary. You might have incontinence, which is leaking, as a result of a weak pelvic floor, but you can also have incontinence as a result of a too tight or a strained or an overworked pelvic floor. So the best way would be to have an assessment to really see what is happening in your pelvic floor. We can kind of generalize and say, usually if there is urge or stress incontinence, that there is an element of weakness, but that's not always the case. I must say, I have to just correct myself. The last at least 10 patients that I've had with stress incontinence, which is when you sneeze, laugh, cough, run, have actually had a pelvic floor that's too tight. So it's so hard for me to generalize. Usually if there is a constipation, there might be too much tension around the back passage, so the person's struggling to let go. And the same thing with dyspareunia or penetrative pain. It's usually that there's an element of too much tension in the pelvic wall.
When should a person come and visit someone with a pelvic floor issue? I mean, is it the leaks, or when they're constipated or...
So I believe that every single person in their pregnancy, when they get to their second trimester, should have at least one assessment with a pelvic health physio. That's in an ideal world. I feel like that is incredibly valuable. That person can learn how to do a pelvic floor exercise, which is going to benefit them as they progress through to labor. And also the pelvic health physio can help to assess any movement dysfunctions and answer any questions that the individual might have. So that's absolutely stock standard what I feel should be protocol. Then in the postpartum phase, I like every single person in their postpartum phase to come at least 8 weeks postpartum. But remember, once postpartum, you're always postpartum. So if you're 2, 3, 10, 12 years postpartum, it's not too late, because we can assess what's happening in the abdominal wall. We can look and see what's happening in the pelvic floor. Is there a strength issue? Is there any concerns that you need answered? And outside of that, I would say if there is long-standing deep hip pain, long-standing lower back pain, coccyx pain, and you feel like you've been to every physio under the sun, or every chiro, or every other practitioner, and you feel like you've never felt like you've received an answer, then you need to have your pelvic floor assessed. One day, I believe that every physio will have pelvic floor experience, but that's just not the case right now. So if there's long-standing issues around your pelvis that have not been resolved, chat to a pelvic health physio. And outside of that, those little niggles that I mentioned before, constipation, a little bit of incontinence, go and speak to a pelvic health physio. You might find that in 3 sessions, your questions are answered and your symptoms are resolved. You can save yourself years of holding back laughs or getting into the menopausal phase and then struggling with incontinence at that phase. There's so much that can be done, and we just need to just spread the word that Just like you would treat a sore neck, we can treat a dysfunctional or painful pelvic floor.
So how do you help a woman prepare for pregnancy, for childbirth?
Oh, many things. Okay, so if there's pain, we absolutely need to manage that pain, because pain will change the way you walk, the way you function, amount of exercise that you do, and we know that exercise is essential for our mental health, our physical health, as well as baby's health. So we manage pain. Then we make sure that the individual is moving and exercising in a safe manner. And we might identify, oh, you've got a diastasis, which is normal, but I see a lot of coning when you're moving in your rotating in bed or getting out of bed, or you might find that it's presenting itself through your exercise routine. So we would then teach you certain movements and ways to engage in order to help you to move more comfortably without exacerbating that tissue tension that you're getting in the diastasis. We would make sure that the person feels comfortable and confident through movement and exercise, because a lot of the time through pregnancy, we feel nervous, we're anxious, we're not sure what's safe, what's not safe. Because there's this history of people that are pregnant being told, keep your legs really close together, don't run, don't jump, don't do these things, and there's so much that can be done. And we just need to reinstill that confidence in movement. So loads that can be done like that. We can also provide the education about what's going to happen as you progress through to labor. We give you movement routines to follow to help baby to descend, to help you cope through potentially, and help you to feel as though you're contributing and helping baby to descend into the canal. And then we, in that postpartum phase, early postpartum, before you've seen your doctor, before you've seen your physio, we help to prepare individuals to make sure that they know what they can do with their bodies, so that you don't sit for 6 weeks fearful of moving. Does that answer your question?
Yeah, it does. So what led you to this sort of work?
So I'm often asked this. I actually first graduated as a marine biologist. I have a love for the ocean, and in this degree, I was exposed to ecology. And we started learning about reproductive health at one point, and I fell in love. So this science degree led to me taking on a second science degree, which was physiotherapy, which is where I intended to expand my knowledge in reproductive health, essentially. So I went into my physio degree with an intention to understand the pelvis. And that's kind of how it started. And then the more I researched, the more I found out that this industry is so taboo, so unspoken, underserved, and just needs a lot of TLC as practitioners as well as patients. And that just led me to just dig deeper and deeper and deeper, and I've absolutely fell in love with working with pelvic health concerns in general.
Is there anything else that you'd like to add that I haven't asked?
I typically try and get people to feel a little bit more comfortable in their own skin, right? There's this underlying taboo, like I've mentioned a few times now, that makes us feel as though our pelvis isn't part of our body. If you look in the mirror, you know and understand your face. You can name your eyes, your nose, your mouth, your throat, everything. When it comes to below the belt, we feel a little bit more disconnected. And a majority of people do not know the names for the different areas of anatomy. So I just try and encourage individuals to get to know their bodies better, It helps us to advocate for ourselves that much better with a doctor, with a partner. Even in our youth, there's lots of research that has shown an increased ability to advocate for themselves when they know and understand this area of their body. So getting to know yourself confidently and comfortably would be my number one. That would decrease the barriers of individuals reaching out for help when they need them. And the second would just be, you don't know what you don't know. So don't be hard on yourself. If you have lived with constipation for the last 5 years and you haven't reached out, if you didn't know that a pelvic health physio can help you, there's no ways you would have reached out. So be gentle with yourself. If you didn't know before, don't be hard on yourself. But this is a great time to reach out and resolve it because you deserve it.
Now, I said in the opening that men also have a pelvic floor. So do you treat men?
So if you've got a pelvis, you've got a pelvic floor. Absolutely. So majority of my clientele are individuals that identify as female. I have treated a number of men, but I have done a lot of studying in order to know and understand the female body. And I would want those males to have access to a physio that knows every detail of their being, their hormonal profiles, etc. So the gold standard would be for them to go to a men's health pelvic physio. But if that's not accessible, a pelvic health physio in general can absolutely help you with your concerns. Okay. So yes, I've treated a number of men successfully, confidently, comfortably, but majority of my field is with females, yes.
Okay. So, Candice, how can people reach you?
So, thank you for asking. I am based at Align, and that's at Kamana Bay. And if an individual wants to book a session, they can either contact through Align, so that would be info@align.ky, or they can use my name, so it would be candice.langford@align.ky, or you can call and just ask for the pelvic health physio at Align, so that would be +1345 640 5050. And you would also find me on social media. If you just look up my name, Candice Langford, pelvic physio, you will find a lot of free content and guidance through these topics that I love to just share with the world.
Thank you so much for being on For the Health of It.
It's such a pleasure. Thank you for having me.
I've been interviewing Candice Landford. She is a pelvic floor health therapist. We are moving you to the life you want.
If you or your loved one is facing cancer, only Sylvester will stand firmly by your side at every step, from diagnosis through survivorship, providing you and your family peace of mind and assisting with everything you need before, during, and after your stay with us. Sylvester Comprehensive Cancer Center is South Florida's only NCI-designated cancer center and specializes in treating the most complex cancer cases. Your first-class cancer care is just a flight away. Learn more at sylvester.org.
Are you feeling anxious, overthinking, or stressed, struggling with sleep and focus? Your physical health may be suffering too. Research shows that stress directly impacts your well-being, making it harder for your body to heal. At the Lightroom, we're here to help you find your balance. Our unique facility promotes the theta brain state, which is your body's natural way to achieve restorative rest and repair. Visit us at the Lightroom, Pasadora Place in Georgetown, and let us guide you back to wellness, rediscovering, tranquility and harmony, because you deserve to feel your best. Call us on 938-HEAL or book online at www.thelightroom.ky.
When I first started going to healthcare pharmacy, it was because it was convenient. But over the years, I continued to shop there because I trusted them. One day I was picking up my prescription, and the pharmacist noticed an over-the-counter medication in my basket. She said, "I hope that's not yours. It will interact with your prescription." And I thought, wow, thank you. Trust is so important when it comes to your health. Healthcare Pharmacy with 2 locations, Grand Harbor and Governor Square, where they care about my health.
This is For the Health of It with Tara Bush. Brought to you by the Health Services Authority. Caring people, quality service. Visit hsa.ky.
For the Health of It with Tara Bush.
Brought to you by Healthcare Pharmacy, where they care about your health. 2 locations, Governor Square and Grand Harbor. Refill and transfer prescriptions online. Call 947-8900 or visit healthcarepharmacy.ky.
Also brought to you by Cayman Medical Center, Cayman's most awarded private medical clinic.
And UHealth, International University of Miami.
World-class healthcare in the heart of Miami.
The Lightroom, your holistic sanctuary for physical and mental restoration, repair, and rejuvenation. The power that made the body heals the body. 38 Pasadora Place, Georgetown. Find us online at www.thelightroom.ky or call 938-HEAL.
For the Health of It with Tara Bush.
Information, entertainment, inspiration.
Covering Grand Cayman, Little Cayman, Cayman Brac.
Since 1976.